Today, my guest is Vita from Myolavita, and she is a myofunctional therapist that specializes in jaw pain. So, Vita, thank you for agreeing to talk to us and sharing your expertise. I'm so excited to talk to you today.
Thank you, Cher. Thank you for inviting me. This is super exciting. Very happy to talk about everything about orofacial pain and TMJ. I started my journey, I would say, from orofacial pain to purpose. Since I was little, I had never had a good night's sleep, and I would have restless sleep, nightmares, sleepwalking, sleep talking. I was in speech therapy until about age 10, and I was that child that was labeled as hyperactive kid in school who would always be distracted, who would not listen, who would be all over the place, a hard time studying, hard time memorizing. And I could never understand why. It wasn't that I wanted to be that child, right? I wanted to be a good child to my parents, but for some reason I could never stand still and understand what happened in classroom. It's just like I always needed movement to memorize things. And then at the age of 17, I got into braces after many orthodontic consultation. A lot of dentists could not take my case because they kept telling me my mouth was small, my jaw was small, there's not enough room for my teeth, so we need to extract some teeth, some adult teeth to make room. And they done that, and after years of braces I started to have not just horrible sleep that I had before since I was like 5, as I remember. I never had a good night's sleep, not just bad sleep. On top of it, I started having jaw issues, and that's when my real journey started. I was like, oh my god, I have to figure it out. What is happening to me? Why is this happening to me? Why all of a sudden I got this pain in my jaw joints, and as well as migraines started with it, migraines, headaches. And I didn't realize it was all connected until later in life. And then because I was suffering so much with the teeth and my bite and my jaw pain, I got into dental school because I was like, oh my God, if I'm going to go into dental school, I would be close to the people that work on all these things, and they're going to fix me and they're going to help me, and it will prevent my kids to have those issues as well later in life, because I knew it was genetic to have missing teeth or small mouth and stuff like that. So hygiene school, I went to work with dentists, and I was like, oh my god, this is exciting, they're going to help me, they're going to help my jaw pain, my jaw will not click and pop anymore. And yet, after years in dentistry, I couldn't find the right answers for myself. So I started to get into a holistic world, dental world, medical world, trying to find the answers for my chronic pain. Because by that time, I was so long in pain. So it was from like 2007 to 2017. So that was like 10 years of pain, severe chronic pain that would get even worse. I would try different appliances, different dental devices, nothing would work. And every temporomandibular jaw doctor, every jaw doctor I worked with, they were like, you know what, let's try this device, let's try that device, let's see what works. And all of them caused even more pain and more issues with my whole body overall. And I was like, this must be connected. So I got into homeopathy, naturopathic medicine, trying to connect the dots. I'm like, it's not just my head, it's my whole body. And then I got into myofunctional therapy, which changed my whole life. There was this one person that visited my office, and she was like, you're looking at it all differently. You have to look at the muscles and how you sleep, because your sleep apnea is connected to your jaw pain. And I was like, what are you talking about? Like, what do you mean my sleep apnea? How do you know I have sleep apnea? And she's like, I can see it like by your eyes. Your under eyes are so like blue, like all the signs that we look for as a myofunctional therapist. And she's like, you have to connect them together. You have to look at the sleep apnea, everything that is happening to you when you sleep, and connect it with your jaw pain, because it's all your muscles. Your muscles are not working properly. You're not talking properly. You're not swallowing properly. I'm like, what do you mean? I was in speech until age of 10. I speak properly, you know? So it was very interesting to me. And pandemic happened, and I had so much time, free time to look into my functional therapy, and I got into it, and it changed my life. I put everything together I learned, and my functional therapy was the last puzzle piece in my journey. It changed my whole life. I was in so much chronic pain for so long that after 2 months of doing my functional therapy and getting my muscles working properly, like my muscles stopped spasming and I was out of pain. And that was like without any device, anything I used before. Like those things didn't help me. And when I connected them with the muscle work, the pain just disappeared. And I was like, oh my God, why is no one talking about this? We need to talk about this. So I started to go into dental offices because they're the ones that are seeing those patients with that facial pain, with those sleep issues, and they're not connecting it together. So I started to go into different dental offices and preaching, being like, listen, you have to look at the tongue thrust, you have to look at the tongue ties, you have to look at the sleep. It's not just the jaw, and we have to connect this. And it was difficult because some offices opened their doors for me, some did not because they were so stuck in their old ways. And it's really hard to change that. That's why I'm here. I'm trying to spread the message that myofunctional therapy can help a lot of people with their muscle function of the face, with their orofacial pain, with their sleep, to get their sleep better. And it's simple. There's no surgeries. It's nothing like that. It's just simple muscle work. It's supposed to be natural to us. We all need to know that, how to use our muscles properly.
It starts with a kid, when you're a child, with the
Yes.
reflex,
Yes.
biggest nerve, and you talk a lot about that. And I think that a lot of dentists aren't getting on board because there's not enough research for them, right? There's not enough
Yes.
proof, but we're living proof.
Yes.
Most of us myofunctional therapists are, because we've had this journey of pain or some dysfunction that was a problem. Like I was told my daughter would outgrow bedwetting and she didn't. And so you talk a lot about not only that, but your story was amazing. So, if you're listening and you're going through that, or you have a child that are going through that, definitely reach out to a myofunctional therapist or someone that knows airway. But you talk about the vagus nerve. So let's talk about, what you need to look at when you're a child, getting the vagus nerve and the whole body into it, not just the muscles of the face, because you talk a lot about that.
Yeah, so definitely the vagus nerve and the bedwetting comes into it too, because a lot of, yes, we talk about airway and bedwetting, how it's connected, but it's also the nervous system. And I'm big on nervous system. I feel like the main thing is always the nervous system. If your nervous system is dysregulated, the body can never find that balance and that healing. You have to fix the nervous system first. How that can happen, like if a child is not sleeping well, if you have her, and that was me. Like, I remember I could never get enough rest. Like, I could never wake up in the morning. I'm that person that I would sleep for 10, 11, 12 hours and I would be still tired. And it was so hard for me to function in school. And you have that child that sleeps through like 10 hours, and the parent be like, why are you not getting up? You have to get up to school, and it's really difficult to wake them up. What happens is our vagus nerve controls our sympathetic and parasympathetic nervous system. There should be a balance. You cannot get rid of the sympathetic nervous system. You need sympathetic nervous system to function. So when a child goes to sleep and they have airway issues, there's a blockage or something's happening, they cannot breathe properly, the body never goes into that parasympathetic system. When we sleep, what's supposed to happen? Rest and digest. We are resting. Your body has to go into that deep sleep. They don't go into that deep sleep. And then that's why they wake up tired but wired. So they will go all over the place. There will be that, just like I said, I was that hyperactive kid in school. I was sleepy, I remember, and I was so tired and sleepy, but yet I had to function to keep going. And I would reach out for snacks to keep going. And that's why it would affect my weight. It would affect, it just affects the whole life. It's very interesting. And it's a struggle. It's a real struggle for parents because they have this child that the teachers put like so much pressure on, be like, something's wrong. Like, why is this child so hyperactive? Let's put them on medication. Let's do this. No, if we can get their nervous system more regulated, tell them that it's okay, like we got you, support them, do different things that they can do during the day to support their nervous system, that self-care, that something play outside, no electronics, because electronics activate our sympathetic nervous system. Do things that can stabilize that nervous system during the day so that child can sleep better at nighttime. I'm a big on essential oils. I love essential oils for sleep. So even for adults as well. Like if you do an essential oil diffuser half an hour before bed, you mix a lavender with lemon. I do like 5 drops of lavender, 5 drops of lemon, 5 drops of peppermint. So the lavender comes down the nervous system so they can go into that deep sleep. The peppermint opens up the airway passages so they can breathe. And the lemon is actually antibacterial, antimicrobial. So when you put those three together, the child can sleep better and the adult can sleep better. So it's also the whole family, because we can't treat a child because the mom whose child has that ADHD or hyperactive child, right? They're hyperactive too because they don't understand what is going on, what is happening. So we need to treat the whole family. Whenever I work, if I do work with kids, I treat the whole family. I change habits of the whole family because as a child, you mirror everything the family does. So if you asking your child to stay off electronics, meanwhile you're on your electronics, no, like that's not fair. And the child will get angry and they will rebel against it. So you have to be careful with that kind of stuff. So as well as sugar, you of course you don't want the child to have like that bad sugar. So you want to hide it and not eat it in front of. Yeah, so going back to essential oils are great. Make sure it's like a trusted brand, not something like bought from Marshalls or Home Goods. So we want to go for like doTERRA is my favorite, Young Living, Revive, those kind of essential oils. But essential oils are great. I love also magnesium Epsom salt bath. They're great thing to do, especially for mothers who have kids that are hyperactive and they know do that self-care, and that could be their self-care. Just light up the candle, breathe that. You can do the essential oil diffuser or a candle and breathe that lavender in and get that magnesium Epsom salt bath so it can relax your muscles, so you can feel good and it can get you ready for that sleep. But you can also do the same thing with a child. Child's body, the skin will absorb the magnesium it needs. Right? So it's not going to be too much. It's not going to be too little. It's going to take what it needs. So magnesium Epsom salt bath are great for sleep. It's great for vagus nerve stimulation. Another one I love is humming. Like if you hum a melody. So kids need attention. I remember as a child too, I always wanted my parents' attention. So if we can incorporate certain games that we can do together as a family, right? Like humming a melody. So you hum a melody like, and they have to guess it, what it is, and do like a guessing game. But humming helps activate that vagus nerve and stronger vagus nerve tone. So I would definitely recommend those. Those are great things to use.
And that's a great idea because humming also helps with the soft palate, which leads to snoring and clenching and grinding. And all of those are symptoms to a deregulated nervous system and trying to get the tongue out of the airway. So a lot of dentists will give you a night guard, like you said, an appliance, and that's just putting a Band-Aid on it, right?
Yeah, definitely. And then it makes me actually really mad when they say that to the child. Like if the child grinds their teeth and be like, oh, your child's going to grow out of it. They're not going to grow out of it. They're going to grow into a sleep apnea patient. Like, no, then you never grow out of it. It's not normal to grind your teeth at night. It's a stress response. Your body is trying to get that oxygen. Your body's trying to get it's symptoms. So like all of the symptoms is our body talking to us. It's like our body sending us a text message. Please help me. Please look at this symptom. There's something happening. Help me. See me. So we have to look at those symptoms and dig deeper before those symptoms become into chronic and more severe things like sleep apnea. So yeah, definitely.
Yeah, our mouth definitely gives us warning signs, and we don't look at that enough. We treat our mouth separate from the rest of our body. It even has its own insurance. I talk about that a lot, but it's all connected and it is the window into our body. So that's where we should start. What is your mindset? How do you breathe? What's going on in your mouth? And then that affects everything else, right?
Definitely. Oh my God, definitely with that one. Yes, our mouth is a portal to our body. Like you have to, there's so much happening and there's so many books I'm reading and always researching on it. Our teeth are like sensors to our brain. They like it's very important to take care of our mouth because if we don't have teeth, it's not that we cannot just chew, but it's also, again, sensors to our brain to make our brain fluid flow and then the whole body as a function. So yeah, we cannot separate the mouth from the whole body. And a lot of doctors do that. A lot of doctors are also opening up their eyes and they're like, you know what? It's not separate. We have to treat it together. And that's why they start screening for sleep apnea. Because I see a lot of people like a dentist screening for sleep apnea. Yes, because we see you so long, like in that chair. There's so much time we spend with you. We can see so many more signs of it. So yeah, I'm very happy with that we are going that route.
And we're
Definitely.
starting to look at those signs and treat it and
Yeah.
put it together and yeah,
Yeah.
all back together. And a lot of people also think no pain, no problem. And you end up with people that are in pain and they don't know where else to go. So you
Yeah.
have a lot of the tough cases.
Yes, definitely. The other thing is that with no pain, no problem. For example, most of the people that get TMJ issues or any orofacial pain are mostly women due to the hormones. The estrogen plays a big role in it. What happens is no pain, like no problem, right? But so it's when the estrogen peaks. So they either get it during the puberty orofacial pain. That's when the problem happens after pregnancy or before menopause or after menopause. So you never want to wait for that because when pain comes, it just gets worse and it's harder to treat. You always have to prevent what's going to happen. You always want to look for something that can prevent the issues, more issues down the line. You never want to wait for pain.
What do you recommend if like we're telling people don't wait, let's prevent it? What are they looking for before they get to the pain?
I would looking for like stress response, like how they breathe. Definitely. Like a mouth breather, like if a person breathes through their mouth, that's automatically our nervous system in a fight or flight. That's it. Like you hyperventilate and person's hyperventilating, that's a nervous system, affects your nervous system. Whenever a person hyperventilates, that's a sympathetic nervous system. The body's constantly sympathetic nervous system. Someone whose neck of range of motion is limited, someone who cannot turn their neck. Like I get people that actually cannot turn their neck. It's crazy. Like, and I will ask them, I was like, can you turn your neck to the right? Can you turn it to the left? And you will see all this neck tension. And they're like, actually, I cannot turn fully to the right or left. And I was like, well, imagine if there's someone or something like a tiger chasing you behind you, and you unable to turn your neck and be able to see it, your body is in constant sympathetic mode. It's like fight or flight all the time, right? And that's why people get that neck tension, they get that shoulder tension, and they would not relate it to the TMJ muscles. But those are all your jaw muscles, right? This is like your whole jaw muscles, it's all connected. And then they get those issues with their shoulders, with their neck, and they go to a chiropractor, a physical therapist, and they do like a quick fix, I call it, because you have to constantly keep going. There's always like every week you have to go, or every 2 weeks to get that relief. But it's just because your muscles of your face, head, and neck are not functioning properly. And then there's also correlation between your jaw and your pelvic floor and hips. Like I remember when I had my jaw pop and click, and my left side jaw would pop and click, my right hip would pop and click. But if you look at it, look at the anatomy, your jaw joint hangs like this, right? The lower jaw, and those are your hips are like the same way. So of course it's going to mirror each other. Of course they're interconnected. Again, going back to the when you said that our mouth is connected to our whole body. You have to look at it. You have to look at those signs. So it's very interesting how you treat one thing and then the other part of the body gets fixed as well. And you're like, oh my God, yeah, my hips do feel better. Like, what just happened? Like, why? And it's very interesting. And it's all comes together with the jaw joint, the spine, the hips, the nervous system. It's all together in it. Yeah.
Abs, core, and pelvic floor. There are so many women that are suffering with
Yes.
that. And it's all connected as well, even with the fascia system.
Yeah.
And again, we don't talk a lot about that, the body
Yeah.
work, clean everything up. And that's where the tongue tie comes in too, because it's connected all
Mhm.
the toes.
It starts there. It starts there. And then also if you keep the tongue on a spot, that activates your vagus nerve too. So that's why little kids suck their tongue. And the parents are be like, oh no, you have to quit that. They try to remove that. But if you do it forcefully, so they're looking for comfort. It's a
Mhm.
comfort. Sucking the tongue is a comfort because it stimulates that vagus nerve. It's that spot. It stimulates that in the brain. And they're looking for that comfort, and that's why they put the finger in, right? So if you put the tongue to the spot and you hold it there, that prevents the clenching and grinding. Why? Because it also puts you in that parasympathetic rest and digest. So it's very interesting how our tongue posture and how our muscles come and roll with the whole body. It's just like, it's so fascinating. When I remember when the first time I learned it, I was like, oh my God, like the whole world needs to know about this.
I agree. We're very passionate about this. And when you keep your
Yeah.
tongue up too, you can't breathe through your mouth. So
Yeah,
we're meant to breathe through our nose. We were not meant to be mouth breathers.
we were not.
Yeah, it's crazy. So if someone is suffering from jaw pain, what do you recommend they do if they can't find someone? Because most of the people that are in pain have tried so many different things. What
Yeah.
would you recommend they do if they're in pain and they haven't found anyone to help them yet?
Yeah. So that was me. I was suffering from pain. And again, I'm that person that was in dentistry. I was so close to that specialist, the jaw specialist. I'm like, why are you not helping me? Why is this not working? Right? Because there's so many factors in it. Like people with jaw pain are the ones that get misdiagnosed a lot. And also they get put from one doctor to another. So usually they start with the dentist, and the dentist freaks out and they're like, you know what, let's send you to ear, nose, throat doctor. Ear, nose, throat doctor tries to figure it out. Maybe it's the ears, maybe it's the sinuses. And then they realize, no, it's not, it's still the jaw joint. Let me send you to the oral surgeon. So they have this, like they go from one person to another, and then to the point there, I went once to one doctor, and they did a sleep study for me. They told me I just had mild sleep apnea. And I was like, I have this issue with my sleep. I have this issue with my jaw, and I know it's connected. Please help me. And he was like, oh, it's just mild sleep apnea. You fine, lose weight, do this, do that. And maybe you depress and definitely have anxiety. Let me put you on medication for those. I'm like, what? I'm like, you're not acknowledging what I'm going through, and you just want to put me on medication for something. If you didn't sleep for 30 years, you would have depression as well. Like, I went off on this doctor. I was like, no, you can't do this. I just wanted to be listened to. I wanted to be acknowledged that what I'm going through is real, because this is something that people don't see. It's not like it's not like I broke my arm or something happened with my body and you can like see it. It's not. It's here, and you don't, and people don't see that there's something going on here. And it does make us have that anxiety, because that stress level, that chronic pain raises your sympathetic, your that nervous system, right? And then also the other part of it is that you're not listened to. Women mostly suffer with TMJ, right? Even their husbands be like, I remember when I was eating out, and my husband would be like, don't eat that because your jaw will lock, and then you will be in pain, you'll be complaining about it. And I'm like, what? No, like it cannot be like that. Like, this is very common. It's abnormal, but it's common with a lot of women to have this pain. We are in pain. We just want it to be listened to. So there are help out there. If I go back to like 15 years ago, right, when my jaw pain started, if I knew about myofunctional therapy, I would find a myofunctional therapist that knows about the jaw. Like, they know, they either suffered from it or they have someone in their family that suffered from it, because they will understand what that person goes through.
Mhm.
They will connect. They will have that compassion. They will be like, I understand what you're going through, the pain you're going through. Because the chronic pain from jaw pain, the orofacial pain, doesn't matter where it is, this area in the head and neck area is so bad. Like, sometimes it triggers migraines that you can't get out of bed. Like, there were days where for like 2 days I was in bed. My husband couldn't even open windows or light to go into the room, because that's how severe it was, right? So it's a lot, and it gives you that I still have that PTSD. I go to dental offices and I get into the chair and my jaw starts to tremble. I literally hold my face and I talk to my jaw and be like, you are okay. You are safe. This is not going to hurt. I've been working on you for so long. The muscles are functioning properly right now. You will be safe with this visit. You will get this cleaning and you'll be fine. You're not going to lock. You're not going to be in pain for a week or two after this. You're safe. So it's just that compassion, even just, again, hugging the face and talking to your part of the body, because sometimes we're so strict with ourselves. Sometimes we get mad at it and being like, why do you hurt? Like, why is this happening to me? Why? And again, is the body trying to talk to us? Because it knows if we don't take care of this little part of the body right now, later in life, it's just going to come back worse for us. So there are answers, and I would definitely start with the myofunctional therapist who has idea about the jaw, like who has suffered it themselves or have someone in their family, because they will have tips and tricks to give you to get the help you need. And also, they're the ones that will send you to the proper airway focused dentist. They're not going to send you to the dentist who's like, oh, jaw pain, here's a night guard. And that will make it, like, for me, night guard was the worst thing ever.
Me
Like,
too.
I was in open lock position for a whole week, and I came back to this dentist. I was like, look what you did, and like, what can I do with this? This is making me worse. And he's like, I don't know what to do. This normally doesn't happen. Like, maybe you should see an ENT, an oral surgeon. And I spent thousands and thousands of dollars and
Yeah.
time
Yeah.
into this. And I was like, okay. And then I saw the TMJ doctor, and they will give me another appliance, and that caused me pain. Or, and that's the patients I get. Like, they will come to me and they be like, I have this appliance and it works. I wake up, there's no pain, I feel great. And then by the end of the day, I'm in pain again. Like, what is happening? And I'm like, I call it the TMJ pain roller coaster. You have a relief from this appliance that they give you, and then all day long, no one is supervising. The dentist that give you this appliance doesn't know that you are hand leaning, you sleeping on your face with the hands under the pillow, right? Moving that jaw out of the alignment. You are chewing wrong, you're swallowing wrong, you chew gum, you are eating certain things, the habits you have during the day, right? The muscle misuse you have all day long, right? They don't know about that. And then they're like, well, it works, you wake up better, that's it, I can't do anything else, right? The dentist would be like, I'm out of options. This is where myofunctional therapy comes in. Myofunctional therapist would be like, oh, this is a bad habit for your jaw joint. You cannot do that. You are swallowing wrong. Like, you are using your jaw joint so many times per day. Like, you and I know we swallow like 2,000 or more times a day, just our saliva, and overusing our jaw joint for that. We're not supposed to move our jaw when we swallow. And many people do, right? And that's so much stress on the jaw joint. And the jaw joint is like, you know what? Enough is enough. I'm going to talk to this person by giving this shooting pain. And then all of a sudden, the person wakes up with that shooting pain in their jaw joint. So I would go with a myofunctional therapist because they can guide you where to go and you will be listened to. So many people get misdiagnosed with the TMJ or any other orofacial pain, right? And they spend so much time and money, or they've been told that something's wrong, like maybe it's just depression or anxiety. Because again, you cannot see it. You cannot see that pain. You cannot feel that pain. So if a person never went through it, they don't know.
That's another good point you bring up too. When you have chronic anxiety and depression, when you're sleep deprived, you're going to have chronic anxiety and depression because
Mhm.
your vagus nerve is off. We're like a quarterback. So you might need a chiropractor or a body worker or a cranial sacral facial therapist or an OT or a PT. Like, it can take more than just one person to help
Yeah.
you when your body has had so much trauma.
It's becoming more and more aware within this last 4 or 5 years I've been into it. So much have changed. So
Mhm.
much have changed. And even the doctors I spoke to 4 years ago, they're coming around and asking me questions now because it's everywhere. Everyone is talking about that tongue position. And it's everyone who has like jaw pain. My biggest concern is when they go online and they start watching those videos on TikTok and social media, right? Trying to work on themselves with that suction in the tunnel of the mouth and doing all these things. They're learning new muscle compensations, right? So we don't want that to happen, but that they have no other option because they look for help. And when they go to the dentist is like, you know what, like, oh, here's the night guard, here's this, here's that. They don't fix the root cause, and a person deep down knows that that's not the right answer for me. I have to keep looking, and that's what they do. And it's like a trial and error. That was me for those like 10-15 years. That was me. I was that person too, looking through, doing my research online, trying to find the answer for me. So I feel like the best thing to do is, if someone suffers from orofacial pain, is to seek a myofunctional therapist, ask them what is their training on their TMJ, what is their experience, what they went through, why they would be the best candidate for them, the best provider for them. And then they will be able to guide them into the right hands of a dentist, a body worker, and everyone else you said. Because it's a team approach. It's never just one person. It's a team approach. Because like they cannot afford certain things. Because that's a lot of work, right? That's a lot of providers to see, right? We can start with one thing, like with myofunctional therapy, with breathing. There's so much that can be done with just breathing. Like you just learn how to breathe properly, your nervous system relaxes, your body relaxes, the muscle function, right? Like help get them out of that muscle spasming. Because if you cannot move that neck to right and left, that's your muscle spasming. If you puff up your cheeks like that and your range of motion of neck is better, that's because your cheeks, the muscle here, the chewing muscles are spasming and they're constricting all those teeth on that bone, and they push your bone in the mouth. Your teeth is the bone, right? They push on it. It pushes your whole spine. It pushes your whole body, and you kind of like in prison within your whole body. Like it's just crazy. The cases I've seen, and again, there's help. We can help. We can help guide them, and they can talk to us and let us know all of their concerns, and we can guide them to the right hands that they need to go to. Yeah, there's answers.
Yeah,
There's
that's what we
answers.
want people to leave with is if you're in pain, listen to your body. There is someone that can help you.
Yes, there are people that went through it, and they can help you, definitely.
So if someone wants to work with you because you have so much knowledge when it comes to pain and that, how do they get a hold of you?
So I'm most active on Instagram, so at the handle Myolavita, and also at my website. So on my website, if you go on at www.myolavita.com, you can schedule a consultation with me, like do a consultation first to see how I can help you, because there's some people that reach out, guide them into for like a physical therapist or someone to see first before they see me.
I'll put a link in the show notes. You guys can click there to find Vita. And Vita, thank you so much for
Thank
sharing
you.
your expertise and doing what you do. I mean, I think that the universe puts us through things so we can help people. You can either go off the deep end or you can, do something good and positive with it. And you have chosen to do that. And so I'm grateful because I've learned so much just knowing you.
Oh, thank you, Sherry. Thank you so much for having me, and thank you for all you do. And your podcast is amazing. That's great because you help so many people. Thank you.
Thanks. Is there anything you would like to end with before we say goodbye today?
Yeah, so again, just like you said, there is help. Reach out and we can help you. And people can reach out to me, people can reach out to you and just ask for help. Self-care is so important. And a lot of mothers put it on the side and they put their kids first and they take care of that. No, we have to take care of ourselves, because if our cup is full, we will be able to give up more. So taking care of yourself, taking care of that nervous system, that Epsom salt bath is amazing. So I would highly recommend to do it for all mothers out there, for all the parents before bed, so they can relax and get their nervous system more stabilized with the parasympathetic rest and digest. So yeah, self-care, taking care of yourself first. And again, there are answers. There's so many good providers I met in the last 4 years. And every time I meet a good one, I cry, because again, it's that's trauma I had, again, from all that chronic pain and all of those years to being not listened to and being dismissed, my symptoms being dismissed. So there are people that can help you. Just reach out, ask for help, and we always here, because that's our purpose in life, to help you all not to suffer what we went through.
Exactly. That gave me goosebumps all over my whole body. So I think that is a great way to end that and great advice. So again, thank you so much. And I am just so blessed to know you and have you in my life.
Thank you. Thank you, Sherry.